Eric here with the Lewis County Scoop. Wes recently sat down with HealthSpan DPC founders Dr. Neisen and family nurse practitioner Matthew Scoggin. They talked about primary care, health insurance, prescription medications, and a whole slew of other things. Dr. Neisen does a great job of clearing up many of the misconceptions and questions that people may have about HealthSpan DPC, insurance, prescription costs, and I really think that you're going to benefit from watching this episode. I also believe that he told me he's going to be in the comments when this thing airs. He's going to be in the comments answering questions, and he's going to be giving away gift cards from J. Colty's and the Handlebar and the Bell, I believe. He's going to be giving those away to those of you who engage in the comments. So if you have a question about HealthSpan, DPC, anything health related, ask him. He'll be glad to answer your questions. So with that being said, I do want to give a little shout out to Cafe 6. These little things are called dirty sodas, and this is an orange dirty soda, and you've got to try one of these. They are so good. If you like sherbet ice cream, you're gonna love these. So a little shout out to Cafe 6. With that being said, here's Wes and Doc Neisen and family nurse practitioner Matthew Scoggin.
All right, Wes here, Lewis County Scoop. We've got Aaron Neisen, doctor at HealthSpan DPC, and we've got Matthew Scoggin. We've already had a Matthew's brother on that says he's the better looking of the Scoggins, so
I guess you can put that in the comments.
But known both of them a long time, and gonna try to explain a little bit about what they're about and what they're doing. So I'll leave it to you, Aaron.
Yeah, so we're at HealthSpan DPC in LaBelle. I'm Aaron Neisen. I'm the doc up there. Born and raised in Lewis County, went to Highland, grew up about 5 miles south of town here on Highway J for the most part. Like I say, been here most of my life. I spent 12 years in Kansas City, doing all my medical training, and working for a couple of years, but, we moved back about 3 years ago. And, about a year and a half ago, we got HealthSpan started.
Yeah, you me introduce myself, I guess. That's probably how it works. Matthew Scoggin, went to Highland as well. Then I went to Culver, which was attached to BRCN to get my nursing. Worked over at Blessing for a while, and then got my master's to be a nurse practitioner through Walden University. Me and Aaron had some conversations about starting this clinic that, doesn't really mess with insurance, and it kind of goes back to how things used to be. And I thought, hey, it's a pretty good idea, and I'm pretty young, so, why not give it a try? So we kind of started, putting things together. We had a lot of conversations and, took a lot of research on our end. Starting any business is tough, but, starting a health clinic can have more rules and regulations. But really from when we first started sitting down, 3 months, 4 months, we just needed the clinic to get done, and we got the ball rolling and started seeing patients.
Yeah, so we're in LaBelle, right next to the nursing home. It was the building was always a clinic, shut down right around COVID, I believe, and kind of sat empty for several years. The opportunity came up for us to buy that building. My wife and I, Stephanie Jones, was Jones, now it's Neisen. The opportunity arose for us to buy the clinic, and I'd always wanted to start a clinic like this. I've been interested in DPC since I think 2011 when I first learned about the model in Wichita, Kansas, from Dr. Josh Umber, who's kind of the godfather of direct primary care, so to speak. He's been doing this for a couple of decades now, but it was kind of a situation where I left that first visit down to Wichita pretty energized about the idea, and sort of knew always that it was going to be something that that I would do at some point. And so kind of through a confluence of events with me moving home and the clinic coming up for sale, it just seemed like the right time to get it started. So it's kind of a different model, and so there's a lot of questions folks have about kind of what we do and how we do it and the way things work. But we do what's called direct primary care. So in direct primary care, essentially what that means is we don't take health insurance. We don't bill health insurance. We don't take payments from health insurance. And so we work directly with our patients. So it's a direct relationship. We also have direct relationships with lab vendors and wholesalers for medications. And so we're basically trying to do a kind of a modern version of kind of what healthcare used to be. I spent my whole life going to see, Doc uptown, and with him, and at that time we never really had to worry about truncated visit times, short times, long waits, and things like that. He just kind of took care of folks, and that's basically what we've got going on up there. So, what we do is essentially it's a membership type of model. You pay a flat monthly fee, and you get for that you get essentially extended access to us whenever you need it. So we do. All our intro appointments, all our first visits are somewhere between 60 and 90 minutes long. Everybody has our cell phone numbers. We do after hours visits if need be. I've definitely gone up to the clinic. Been up there already this week filling medications.
Stapling heads together.
Yeah, we staple a few
fish
heads.
hooks. 8 o'clock, 9 o'clock at night.
Right.
Hunters coming in, slicing their hand open. 8 o'clock. I mean, that needs closed up. So instead of waiting around at an urgent care, we get them in. They just text us, send a picture of it. I'd say that the tool of having a provider's phone number, goes a long way, because we save just so many urgent care visits, sometimes ER visits, just kind of being able to talk to a patient on the phone that we know already, that we've seen in the clinic, so we know their history. Anymore, you can't really get in to see your primary care when you're sick or when something happens. And some primary care providers don't even really do sutures or staples or stuff like that.
Oh,
they
that's
just send you
the
to urgent care.
Right. And that's the way it was like when I was a kid growing up with Doc. We were just blessed to have that. I mean, that was normal to us, growing up.
Yeah,
The foot shaking your hand, you just go out there, he'd pull it, and use back home,
Right.
So,
and we were fortunate to have that growing up, and healthcare unfortunately has kind of moved away from that. In the last several years, we as doctors, providers, we've all been sort of in the system, kind of subject to insurance-driven care as opposed to provider-driven care, and so we try to go back to the way that it used to be. It's like a Norman Rockwell painting, the one with the doc and the black bag and
Right.
all that. So I always say you replace the black bag with an iPhone, and that's pretty much what we do. It's something where folks can, like say, have extended access to us, after hours access.
You've seen both sides of it, I guess, means working at Scotland County
Absolutely.
and then doing this. Does it seem easier with what you're doing now as far as not dealing with the insurance companies?
Yeah, for us, it's a lot easier. We've been able to eliminate a lot of the regulatory burden. So the statistic that we cite a lot is that the average provider has 7 administrative employees underneath them and nurses. So, before the doctor can start, taking home anything to feed his kids, you got to pay 7 salaries and the overhead involved with that. So with direct primary care, it's more typical to have about a third of a full-time equivalent employee, so as we were growing, Matt and I were the only ones for not quite a year, but
And your wife, but I
And,
guess seeing
of course,
patients,
so listen,
but
yeah,
she doesn't do that. But
never underestimate my wife's contributions to the whole thing. I mean, she's the reason we're where
She's
we're
in
at.
there every day. I go in.
Absolutely. Yeah. She's there every day. She does, all of our marketing, all of our business side stuff. She's very much pulling her weight on all this stuff. We would definitely not be anywhere like where we're at as far as growth if she hadn't, been part of this. And so, and so, it's easier on us. It's honestly, it's a lot easier on patients, right? So, the ability for patients to call us, text us, and do those things.
same day appointments, when you're
Right.
sick, you get in. It's not like we have a lot of patients too, where it's just, they want the quick access where they can text or call, and that just saves them even an appointment. If they're sick for one day, it's like, well, maybe try some NyQuil or something for a bit. But they can also come in if they want their lungs listened to, or if they got an ear that's kind of bugging them, we can take a look at it, within the same day normally, or the next day, depending. But
Yeah. And so because we're not dependent on getting reimbursed from insurance, we don't need to worry about making a note or a visit that is billable to insurance. And so if somebody texts me a picture of a cut on their arm, I can say, well, I'll see you tomorrow in the morning, or if it's bad enough, meet me up at the clinic in 20 minutes and I'll get it sewed up. And so I don't have to, and especially for things that are like, that may or may not necessarily need a visit. those things can be handled via text message. Like, hey, I went to the health department. They checked my blood pressure. It's elevated. I know we talked about this last time I was in. Do I need a higher dose of my blood pressure medication? Sure. I'll fill it, and it's sitting at the front desk when you come and need it, or I can send it to your pharmacy if you need it. And so, things that would, a person might have to take a half a day off of work and wait 2 weeks and show up and get checked in, and the doctor's 45 minutes late, which I'm as guilty as anybody when I'm at the
I'm always there on time though, so at least I take care of the patients, I guess.
Yeah. So it saves the patient just an incredible amount of time. We try to save to post to our patients. It's if you save a half a day off of work 2 or 3 times a year to go see your doctor, you've practically covered your membership with us. I guess just so I've said it, we for us, it's $80 a month, or as I like to say, $20 a week to have your doctor's cell phone number in your back pocket. If you're a couple or a single parent, it's $150 a month, and then for a whole family, it's $200 a month, no matter how many kids you've got. So we haven't had too many folks that have too many kids, but so far that's been good. Kids are typically able to be taken care of at a relatively straightforward manner, and so we like to offer that service. We do well child checks, things like that, all your standard primary care stuff that anybody might need. We take care of all that stuff, and so we're able to do a lot for patients in a way that does not necessarily cause us to need to use insurance. So, primary care, primary care is not really an insurance thing, in my opinion. That's the way I think primary care should be done. So insurance is, if you think about insurance as a whole, insurance is for rare and expensive. Your car insurance, it's you get in a wreck, your engine blows up.
Right.
Your homeowner's insurance is for, if you have a tree fall in your house. And so health insurance is kind of the only insurance where people want to use it. They sort of treat their insurance card like a credit card that has no limit on it. And so it shouldn't be terribly surprising that healthcare is very expensive when we're using that health insurance card to cover primary care, because primary care is not rare and expensive. It's common and cheap. Primary care should be incredibly common. You should have ready access to your primary care provider. The reason that primary care exists is to keep things from snowballing.
Mm-hmm.
We don't want to see somebody at 65 with 10 untreated conditions. We want to see that person at 35 or younger, ideally, and keep those things from happening to begin with. And so, I've been to several third world countries, health missions, things like that. And you go to these Central American countries, and they've got a better primary care health system than we've got here in the United States. And it's wild. You can go to any village and they'll have a health clinic. And so, like the United States, we don't have that sort of we don't have that primary care system. And so for us, we want to make sure that people have ready access to their doctor, provider. And so,
Thank you.
so we can, stop those things from happening. Preventive care in large part is primary care. And so, we just, obviously if your car insurance covered brakes and gas, your car insurance would be astronomical. So if your health insurance covers primary care, it's going to be astronomical.
Right.
And so, so I believe that primary care should be ubiquitous. It should be there for everybody all the time. And so we don't believe that insurance has a role. I also am very passionate about the idea that you can't do good primary care or as good a primary care as you can when you've got a silent partner in the room. Everybody's worried about what's the insurance company going to say about this. And that's one thing that I know, even from working up at Scotland County, I have lots of conversations that basically consist of saying, ideally we would do this, but because of X, Y, and Z insurance regulation or what have you, we're doing it this way. And so that's not providing top-notch care to people.
I'd say our patients appreciate it too. Most of our patients have insurance coverage, which we recommend anyway for your major medical stuff, heart attack, car wreck stuff. But, they come in, they're a member, there's not a bunch of paperwork to fill out. They don't have to show us their insurance card. We just take care of them, as an individual. We personalize their care. I don't care what United Healthcare has to say. You might want to bleep that out. They might be, spying on us now. But we just try to bring it back to the individual level. We can have a long discussion with patients. We can check multiple labs. We don't say, we don't need to check that lab or something. Plus, there's no copay. There's no deductible. It just kind of gets rid of that, the hassle, try to keep it clean for us and the patient.
Well, my point on it too, somebody local, I'm going to trust you guys more than somebody I don't know.
I appreciate that.
I don't want to go to somebody and they're just going strictly off numbers and stuff like this. You guys, we can talk to,
Absolutely.
and not have to worry about what you're going to say, whether right or wrong.
Yeah.
We're not going anywhere. We've had several patients that just signed up because they know, well, you're local, you're building this thing. So I've had, 2 or 3 doctors in the last 3 years, and I'm just tired of giving the same story over and over.
Mm-hmm.
And then when you do establish with someone, it's like, can you get in with them, or do you have to go to the urgent care to tell your story over again?
Right.
Yeah. I guess just to say, so, in addition to your expanded access that you get with us, my cell phone number, Matt's cell phone number, same day, next day appointments, almost always. Usually getting an appointment is more about the patient's availability than our availability. I don't think we've ever had anybody not be able to get in the same day if they needed to. But we also do wholesale pricing for medications and labs. We get a group discount for our lab work. And so that amounts to essentially 95% off what you would pay going through the system. So if your annual, lab panel for an annual physical might be somewhere between, let's call it $300 and $500, we get that for $15, $20, something like that. A CBC is maybe $100 at the hospital, but for us it's $2 and change. A1Cs are $60 or $80. For us, they're $2 and change.
Mm-hmm.
We also do medication dispensing. So fortunately, in the state of Missouri, I am allowed to dispense medications to my patients under my medical license in my office. And so we wholesale medications as well. So expensive medicines for us are like $20 for 3 months. That's one of the more expensive medicines that we write. Yeah. So for the most part, the blood pressure medicines we write typically are averaging something like a penny a pill to a nickel a pill, something like that. So I refilled a 90-day supply of blood pressure medicine today for $4.32.
It's kind of neat. Patients are like, I spend $25 a month at the pharmacy, and I'm like, $25 here, that'll get you a year's supply of medications, and you don't have to worry about going to the pharmacy every month and waiting in a line.
Yeah, pick it up from us.
Same with your urgent care stuff. A Z-Pack and a steroid shot, $3. We upcharge our meds 10% and our labs just to cover labels, shipping, all that stuff. But 10% on a couple pennies doesn't really add up to much. So
no. And that's meant to keep the incentives aligned, right? My incentive is to keep you healthy. Your incentive is obviously to be healthy. And so what I don't want is there ever be any confusion about why I'm recommending a lab test or why I'm recommending a medication. If I'm recommending it, it's because you need it. It's not because I'm making any money on the back end. We keep prices transparent. You'll never have a surprise bill from us. If you want to know how much it's going to be before I give you the medicine, that's no problem. It's usually some number of pennies. Like, it's usually very, very inexpensive. And so we also offer that. We've got we also have a gym, I guess I'll say. We've got some equipment there, treadmill and a row machine, a few different kettlebells, things like that. And then we have a pretty nice spa area. We've got a sauna, a cold plunge, and some red light therapy right now. But we're always sort of adding things on as patients express desires to have new and different things. So, it's really meant to be a way to keep people well and to sort of provide, like say, that wellness aspect, and keep people from developing chronic illnesses, things that they need to that they're going to need expensive ongoing care for. So
one of our, going back to the meds though, kind of a hot topic is our GLP meds. So like your Ozempic, Mounjaro, diabetes meds, but also for weight loss. We've got over probably 200 patients on them now. Not because, we make a lot of money on them. They just work. We've seen A1Cs drop from 11 to 7 in 3 to 6 months. We've probably lost over 2,000 pounds as a clinic total.
Yeah, we're over a
ton. We lost count. So they just work, and we're not like trying to get patients up to the highest dose. We recommend diet, exercise, and all that stuff on top of it. So, if you get it through your pharmacy, it's, $600 to $1,200. If your insurance doesn't cover it, we get it significantly cheaper.
Yeah. Honestly, most of our medications are cheaper than even if the insurance does cover it. Most folks that our patients. And like I say, most of our patients do have insurance, but high deductible insurance kind of turns everybody into a cash pay patient. You know, if you're 20 years ago, a $3,000 deductible was considered a high deductible. Now it's hard to find a plan that's not that or more. You know, there are very few folks that have the good fortune to have an insurance plan that only has a $2,000 or $3,000 deductible. And so when folks come in and they say, "Hey, listen, my deductible is $10,000," well, you're a cash pay patient then, because most years you're not going to hit that deductible. You know, you're only going to be needing that $10,000 if you have surgery or have a major medical issue. You know, we don't want that. But so what we can do is provide much, much, much cheaper care. And so for folks that have insurances with high deductible, it makes a lot of sense. It makes a lot of sense. We've got folks on all the major insurances, Medicare, Medicaid, and of course the uninsured. For uninsured folks, I mean, it's a great value. But even for even Medicare patients that don't have a terribly high deductible, we have a lot of folks that like us for access, and it's been very good.
Say another big thing is we work with smaller businesses, I guess, anywhere from 5 to 50 employees, and we can take on larger groups too. But for companies that don't offer any insurance or kind of benefits, this is an easy, kind of something to keep track of and budget for and offer to your employees, and then they don't have to take off a whole day to work, to go see a, doctor over in Quincy or Hannibal, and they got to wait in the waiting room for a while. They can get in with us. And then our companies that offer an insurance product, we get, their insurance claims down. So year over year, hopefully their premiums don't go up, which everyone's seeing anymore. We try to keep them kind of flat. So every time you go to an urgent care, ER, that just drives their claim data up. Yeah. So the companies we're working with, we're trying to hit hard with keeping patients coming to us because we don't ding their insurance. So
yeah, we've got lots of groups now. So we take care of the city of LaBelle, Lewis County. Of course, our original business was Moink, Handlebar, Murphy Brothers, Tri-State Underground Utilities. I'm forgetting a lot of folks, but we appreciate all their business for sure. But one of the groups that we worked with who elected to go with an insurance product that fits well with direct primary care, last year, and they only had a partial utilization of the DPC. So last year their insurance went up 4%. National average was 15%. Missouri average was like 12%. And so even with only utilizing us for a percentage of their employees, their insurance claims went down such that they were able to save tens of thousands of dollars in the first year. So it well more than paid for the DPC membership. It's very cost effective for almost everyone. But if you're a small business owner, call me.
Or big.
It's great because it's, health insurance, as I said, with the high deductible, that's a benefit that is probably a business's largest expense, usually behind taxes. After that, it's healthcare expenditure. And so a business is spending all that money to provide a benefit for their employees that their employees can't even really use because they can use it, but it's a high deductible. Right. So they're still a cash pay patient, de facto cash pay. And so with us, you know exactly how much your outlay is every month, and you can provide a benefit that your employees actually see as a benefit, as opposed to a burden on both the employee and the employer. And so it's been very good for folks to be able to actually utilize us and see their health improve and actually get primary care, when before, they were still sort of self-rationing their access to primary care based on, financial issues, and as I said before, primary care is dirt cheap to provide. I mean, it's, like we say, $4 for 3 months of blood pressure medicine. We shouldn't have a system that's set up to prevent people from getting these chronic medications to keep them healthy. We should have a system that's set up to incentivize people to get that primary care so they stay healthy and that we don't need high cost care down the road. 90% of a person's healthcare needs are primary care needs. Obviously, that last 10% can get pricey. That's why we have the insurance. But for the 90% of stuff that's everyday routine, preventive and acute care, that's what we're here for.
It's a good deal.
Yeah, we've seen lots. I can count off a lot of a lot of stories of patients that have seen big benefits. We've got several patients that more than cover their $80 a month just on medications. Just we save them per month. We save them more than the membership, and so they get the primary care for free, and their medications, are much cheaper through us. Of course, we like to utilize we still utilize pharmacies as needed for certain medications. We've got the ability or the will, I guess, to get some medicines that are more expensive. We get those from a variety of places. We find
samples or shipped in from
samples.
Canada.
Right.
So meds that, are made
So-
in the US get shipped up to Canada and then come back to us for cheaper than what you get out of the pharmacy.
Let's say your patients the ones that do have both, that got their regular health insurance, and then is a member, and you don't have it, you can call that script in and then you use your insurance at that pharmacy.
Absolutely. Yeah.
Most of the time, your insurance doesn't even cover meds anymore, though. Like Medicaid is the only one that I've seen cover almost like the full cost of medications. But normally at the pharmacy, if you use your insurance, the med might be more expensive if
Right.
they bill it through your insurance.
But if
yes,
they know you have it, they're
yeah,
gonna
we
use it.
we do prior auths all the time to try to get insurance to cover medications. I mean, these nice GLP meds for diabetes, we still try to send off to pharmacies. And it's just a matter of if the insurance company wants to pay for it.
Right.
And then there's a whole prior auth thing where we try to not really negotiate with the insurance company, but kind of persuade them to pay for it.
Right.
Most of the time it's a hassle.
Yeah, unfortunately, over the last couple of years, as the GLP medicines for both diabetes and weight loss, as those medicines have grown in usage, there's a lot of insurances that have sort of taken those off the formulary list, and so folks that were previously getting access to those medications, they've lost access, and so they're just not on the formulary anymore. And so we got a lot of those folks. We've either transitioned them to other medications that we can get at a more reasonable price, or we use our pharmacy to get those GLPs for them. And for most of our patients, that amounts to something like $60 to $80 a month, as opposed to $600 or $1,000 a month.
Yeah, I mean, you see some of the advertisements on TV for them, and it's outrageous.
Yeah, and so we do a really good job of trying to make sure that
All of your weight loss clinics, we beat the price because we just don't, we don't upcharge it. Those weight loss clinics, they make money from their medications.
Right.
Our bread and butter is what keeps the lights on, just the membership. So you're a member, then my whole goal is to keep you happy, healthy, and save you money where I can. Now we don't take insurance, but we are more than happy to send off orders like for MRI, CTs, send it wherever, what facility you want to go to, and then they'll bill your insurance. So, but honestly, like x-rays, go pay cash and you'll get 40% off. So you can get an x-ray for $70. If they run it through your insurance, it's hard to tell what they negotiated it for.
So let's say you do that, an MRA, whatever, CAT scan. Do you all get access to that back? Do I have to request it, or?
No, they will fax us as the ordering provider. They'll fax us those results when they get them. And so, if you're still in the deductible phase of your insurance plan, an MRI or CT scan, that's generally going to be somewhere around the $2,000 range. And so we still go find cash prices for our patients on those, even if they have insurance, because we can get those depending on where you want to go. If you're willing to drive a couple hours, you can get them for as cheap as, I think, $350 is the cheapest we've gotten those for. But generally, most folks are willing to stay relatively close to home and get them for $400 to $500, something like that. So, I mean, we're still saving folks 75%, at least on those.
It's kind of interesting.
Studies.
When we first opened up, I spent a good 2 or 3 days just finding cash prices, and comparing, one facility to the next for the same procedure or the same imaging. It's like, it can amount to $1,000 to $2,000. That, colonoscopy at one spot is $8,000 and the next is $4,000, and it's just down the road. That people don't really, you go to the grocery store and it's like, oh, this milk is this much or this milk's this much,
Right.
but I'm just going to go get my colonoscopy wherever. The insurance, if you have it, should cover it, hopefully. But
Right.
It's just kind of amazing and weird how they can,
hospitals and
adjust prices.
facilities, they practice cost shifting. And so, if you want to get your gallbladder out at one spot, might be $16,000. If you get your gallbladder out the next spot, it might be $6,000. You just never know. And that's not to mention the fact that you're going to get a bill 3 or 4 months later because it happens to be that your anesthesiologist clinic, whoever they're contracted through, doesn't send their bills out till 90 days at least. Or, if it turns out that your anesthesiologist doesn't participate in your insurance network. Somehow the surgeon does and the hospital does, but the anesthesiologist group doesn't. That's just some of the tricks that we see pulled. And so, we've gone out and done some research, and we found places where you can get all-in pricing for those more expensive tests and some of those more expensive procedures. So we're like I say, the whole goal is to keep people's money in their back pocket so that, keep it local. Right. And I don't necessarily care to have people driving, to over the bridge just to get stuff that we can do for quite a little bit cheaper. The more money we keep locally, the better that is for the community as a whole.
Yeah.
I believe the statistic is every dollar that we save on healthcare generates like $2.50 of local economic stimulus, and so that money just moves around in the community, and it's all positive.
That's good.
Absolutely.
Say another thing is we have Adrienne Myers. She does women's health stuff for us. She's a women's health NP, so all your PAPs, and we do hormone replacement stuff for females and men too. Just testosterone or progesterone, estrogen, stuff like that. We've had a lot of good results with some of those. Really, any patient that comes to us and they're interested in something or a treatment, or they want to check this lab, or they want to get this scan done, we're kind of all for it. We're open ears, I guess. It's like we just tell them the benefit or the risk and stuff like that. We're not pill pushers, like you said. We don't make any money off of it. So we've got patients that want to do everything in their power to not take a pill. So we try to educate them on the right course, diet, exercise, what have you, depending on what it is. But we just kind of talk with our patients individually. So we don't just,
one of the common complaints that I hear from talking to other physicians, in the doctor groups that I'm a part of is, the patient that comes in and, they're requesting, I just want all my hormones checked, and doctors in the system, that's, they consider those patients to be more stressful than average. But, for me, what that person is saying is, I don't feel right. And so what might be the issues? And if they come and they present that as, hey, but what if it is my hormones? What if there is something going wrong on that front? What I don't have to do is say, well, and then give a long spiel about why I'm not going to order those tests, because when the real answer most of the time is your insurance isn't going to cover it. And probably that's not what's going on. And for the most part, that probably isn't what's going on. Like I said, we've got plenty of folks that do need estrogen, progesterone, those kind of things. Perimenopausal symptoms are a big issue. And for the last 2 to 3 decades have been, those ladies, unfortunately, have been very much undertreated. Those problems kind of got swept under the rug. But the point I'm trying to say or make is that those labs for us, it might be a $20 bill. And so if you're going to get peace of mind out of just knowing that, hey, it's not this thing that's causing my problem. Like, I'm not here to say that that's not a good use of $20. That's a great use of $20. A peace of mind. I mean, what's that worth?
And you're pleasing the patient. So,
I mean, and that's to get to the point of it. Yeah, we practice patient-centered medicine. There's, it's not not to say that the customer's always right, but there should be a certain amount of customer service involved with the medical system. It's not a situation where, you walk in and I'm going to tell you how things are going to be. That's, nobody wants to be treated that way. You wouldn't be treated that way anywhere else you go. There's no other setting where that would be acceptable behavior out of somebody when you're in a relationship. And it's even worse if it's a doctor-patient relationship, because that should be the relationship that you have the most trust in and the most comfort in, because those are the people that me, hopefully, or Matt, that you're telling all, problems to, and making sure that we're keeping you as healthy as possible. And you don't want to be self-censoring because you're worried that I'm going to, have feel some kind of a way about it. And so, for us, that's one of the best parts for me, having both worked in the system and continuing to work in the system, to be fair, and doing this clinic, is that I don't have to worry about, if you want to know what a test is, I'll tell you what the price is. And if you want to order the test, I'm happy to order the test. Now, sometimes somebody will want a test and I'll be like, got to be honest with you, that's not necessarily in my wheelhouse. And the result, is either not going to tell us anything, or it's not a result that I can necessarily interpret. And so sometimes it may or may not be a good idea to order some of those things, but that's pretty few and far between. For the most part, if you're curious about, your vitamin D, I'll check your vitamin D. It's, what is it, $4, $5, $7?
It might be a more expensive. It might be $12 actually. Vitamin D. That's our pricey one. But like thyroid stuff, $4. And when you leave our clinic, it's not like you get billed 6 months later. It's like, man, that's pretty expensive. It's just, we tell you up front what the labs cost or what the medications cost. It's like, yeah, your antibiotic and your steroid shot, $3, and then that's it. We'll bill you next month for it, and it just gets added onto your $80 membership. So your next bill would be $83. Just keep it clean. It's just like your gym membership. It just kind of auto renews the next month, and use this as much. I can see you, today. You can call me on Saturday and I'll see you Monday. Doesn't cost you anymore. It's $80. And then we might not hear from you for 2 months. Tells me you may be busy or happy, healthy. That means we're doing our job. We don't get incentivized to get our patients in every day, because that tells me maybe we're missing something, or why are they still sick? Honestly, when the patients, we've had plenty of just be like, hey, how you doing? Just on the street, or just texting like Merry Christmas or something. It's like, well, I haven't heard from you in a while. So, but maybe that tells me I'm doing my job a little better.
Yeah. Yep. I like to let them know that we're still here.
Yeah.
Make sure they're not putting
We tend to bug a lot of them patients a lot, probably more than what they want. Just
we got some farmers, and there's a couple blocks of the year where trying to get a farmer to do anything besides sit in the tractor is pretty rough going. But with it being so easy to get refills and to communicate with us via text message or FaceTime or whatever, it's, well, if you're driving by, you can stop in for 3 minutes and I can give you your blood pressure medicine, check your blood pressure, do a finger stick, draw labs, just get all the routine maintenance stuff done. And it doesn't have to take an hour. It'd be nice to get everybody in there for an hour a year just to make sure that everything's still going okay and that we're not missing anything and that your preventive care stuff is all up to date all the time. But we periodically review everybody's chart anyway to make sure that stuff's going on. And again, I'm not incentivized to bring somebody in for an hour-long appointment where at the end of the appointment, I say, hey, listen, I just needed you to colonoscopy. Or a Cologuard, or some screening test of some kind, right? That can be handled via text message. Hey, I'm going to send a referral over for you to get a colonoscopy. They're going to call you about scheduling. Schedule it in 4 months when the planting's done or when harvest is over or what have you. Or for a lot of folks, whenever sports season that it happens to be is over. We just, like I say, convenient, patient-centered type of care.
Kind of like getting you in on a podcast,
Pretty tough. Gotta
make some
try to
notes
pin me down. Gotta pin me down.
That's no kidding. I'd say, or like younger families too with kids, it's just peace of mind. They can bring them in whenever. It's like, yeah, my kids had these fevers. We can look them over, do school notes, we do sports physicals. I do DOT exams as well for all your CDL drivers. So it's another benefit that some of our employers have is they, just send their, employee over to me and I get it done in, 10 minutes. Yeah. We don't charge anything extra. It's free for members.
We do DOT physicals
for non-members.
$100 for that. So, and we're usually able to get folks in within a couple of days. So, for folks with CDLs that have a difficult time finding somebody to do their DOT exam or time, carving out time to get their DOTs done.
I've gone on site before for some businesses when they have 5 or 10 people that need them. I just knock them out. Less than 2 hours saves them a trip and everything. So it's convenient. It's just another service I kind of wanted to jump into because a lot of people around here have their CDL or DOT.
Truck drivers.
Yeah, some of them say I don't even drive a truck anymore, but I just
keep it up.
I'd like to keep it updated. I'm like, well, perfect. So it's just another kind of aspect to it.
What else?
I don't know.
I think you guys pretty well touched it. I think you got a great thing going. You really do.
Coming to Canton, maybe.
Yeah. We should talk about our expansion.
Summer, I don't know.
Yeah. Sometime summertime-ish, we've got a clinic site picked out that should work out. We got a little bit of remodeling to do. We got to build some exam rooms and do a little bit of plumbing so we can have some sinks in the rooms. But for the most part, that should be well underway within a month or so. So we should be middle of summer, hopefully, opening up in Canton. That just kind of expands access to, the other side of the county. And then obviously there's a highway. So folks that are Marion County, Quincy, Clark County,
makes it a little easier to get there. Yeah. We've been talking to NPs, to bring on there as well. So we'd just bring on more providers as we grow. So it's not like, because with this model, we can't see 2,000 patients in our panel. We kind of take away the value of having a smaller panel and being able to get patients in quicker and text. That'd be a lot of text messages that go through if we had too big of a panel. But once we hit kind of our number, we'll probably stop taking patients or have like kind of a enrollment process with it. But with the new provider, they'll be taking on patients too.
Yeah. So if anybody knows a nurse practitioner, a physician assistant, or even a physician that is looking for a change of pace, we would be more than happy to speak to them, because we're growing as fast as the two of us can stand right now. And like I say, within 6 months, we're going to need at least one new provider, if not two. It's going very well. I mean, it's something where almost everybody sees the value in it. So yeah, like I say, it's good for folks that are looking for access. You get expanded access with us. The quality of the care, I always say I'm not a better doctor than any other doctor that you're going to see. I just have more time to work on a single person. And, the cost for most people saves them quite a little bit of money. Um, you know, as far as specialist goes too, I should touch on that. The 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 health system, the health record that we use, it's built for clinics like ours for DPCs, and so it has a functionality built in where I'm able to consult with specialists through that system. And so rather than rather than have to do an actual sort of your traditional consult where I say, well, listen, I need you to talk to your, you got to go find an endocrinologist, you got a lump on your thyroid or something. I got to send you off to the endocrinologist. Rather than send you off to the endocrinologist, what I can do is I can get a hold of an endocrinologist. We can talk about the case, and then they can recommend follow-up testing, lab testing. Do I need to get an ultrasound? Do we need to get a biopsy? What kind of things do we need to do so that I can do as much of a workup in my clinic as need be before we involve a specialist? That saves folks from having to drive, anywhere from 45 minutes to 2 hours to go see a specialist. And like for neurology specifically, neurologists are almost all of them are about 6 months out at this point. It seems to me we have a very hard time with that particular specialty. If there's a neurologist out there that can correct me, but it doesn't seem like that specialty ever really recovered from COVID, and it's still a pretty good backlog. So basically, if you're an individual with a high deductible plan, if you're a small business owner, if you have no insurance, call us, get a hold of us. We're happy to help take care of you. Like I say, we're growing very fast, but we've always got room for more people. I don't think I'll stop seeing patients, taking new patients until, even if we do have some time before we get another provider on, my intention is to just keep adding patients. And then if we have to shift a few people over because we're getting overburdened with our panel, then that's what we have to do. But I don't want to turn anybody away because we're full. A lot of DPC clinics, it's about 10% of family docs now that are doing DPC, but a lot of DPC clinics will close their enrollments and have a wait list. And, maybe that's okay in a city. But out here where access is such an issue, where the physician shortage is hit the hardest, provider shortage has hit the hardest. I don't feel right about turning anybody away who's trying to get care. But that's not to say that if it gets real bad that I might not have to put the brakes on because I want to provide that value to my patients that I currently have. But,
Right.
But we don't intend to shut the panel down anytime soon. Hopefully we won't have any trouble hiring somebody new, but like I say, I don't intend to, close the panel if we can help from it. And then, like I say, the access expansion in Canton will really be a good one for us. Like I say, it'll open up a big market for us, stop people from having to go quite as far. So, so we are going to give, for everybody who shares the video, we're going to put those folks into a drawing, and we're going to give away a J. Colts gift certificate and a handlebar gift certificate. And then I think Wes is going to get me in here to do more of these podcasts, or to write some articles, some things like that, some more content.
We may get off context too. I mean,
it happens.
Talk about a little anything.
Yeah, sure. And so for everybody who is able to comment a topic that they're interested in hearing about, either in writing or in podcast form, we'll put all of those folks into a drawing as well, and give away again another J. Colts gift card and another handlebar gift card. So, and then of course, if you know a provider who's looking for a job, and I guess I should say too, while I got everybody's ear, if you're an MA, an LPN, a nurse of any kind, we would also like to talk to you. We are definitely going to be in need of some more ancillary staff going forward. So it has grown. This clinic has grown faster than I could have imagined, and so
You're welcome.
Yeah,
I'll take
it's
all the
mostly
credit.
Matt,
Yeah.
really.
The looks, right?
It's the hair.
Yeah.
Oh,
I'm
Yeah.
growing it out a little bit. My beautician was out on maternity leave, but she's been back for a while. But
When he shaved his head, we lost like 60 patients.
I don't know what it was.
They've all trickled back since the
Yeah.
hair's grown.
It's the hair. Yeah.
like a
He doesn't
Sam's-
pay me enough to go get my hair cut.
Right.
That's what it is.
You ain't got
That's
the
what it
time.
is. Yeah. So, I appreciate everybody watching. And like I say, if you know anybody who's interested in talking to us, both as a patient or as somebody who's interested in working with us, especially those small business owners, like I said, give us a message on Facebook. Best way to get a hold of us or call the clinic. So if you come in, you sign up, you say, hey, I'm ready to give this a go. Essentially, we charge the $80 membership fee for the initial consult. If you come in on the 2nd of the month, that consult fee is still $80. If you come in on the 31st of the month, unfortunately, that consult fee is still $80. But we want to enroll everybody. Some clinics will charge a sign-up fee, but that's a barrier to care, and I try not to have any barriers to care. So we'll get you in when we're able. Usually, it's the same day. Almost always, it's within the week. We'll bring you in. We do something like a 60 to 90 minute initial appointment. We go through your entire health history, everything you've got going on, talk about your meds, see where we can save you some money, make sure we've gone through health maintenance stuff, make sure that, we've checked the oil, made sure the brakes are still in good shape, all that kind of stuff. Refills if we need them. We send out for tests. We'll get records from your providers that you've had previously, if there are any. And basically we try to get to know the person as well as we can. I say in all those visits, I always say that I've been doing this long enough that I can adjust my aggression levels with regards to preventive care and primary care that fits the patient's personality. And so, we have patients that they wouldn't take a medication if their arm was cut off. And so we talk to those folks. The phrase in medicine is you treat the patient where they live, not where you live. And so for folks that are more holistic, let's say, we don't have any problem with that. We treat those folks as well as we can on that front. But my personal stance on primary care is that primary care should be done aggressively, and we've had a patient within the last month, because of, I would say, a good aggressive primary care. We identified a renal cancer very quickly and got it out very quickly. And so without that aggressive primary care, it's hard to say how long that would have sat there, at least until symptoms showed up. So we caught a cancer that was asymptomatic, got it out, and, Lord willing, that cancer did not spread. And so without good aggressive primary care, who's to say how long that would have taken to have found out? And so essentially we like to find out who a person is, what their values are. So it's important for me to get to know the patient and the patient to get to know me, and to build that relationship so that there's some mutual trust, and so that we understand each other, and so that we know that we can both get along with each other. And we haven't turned anybody away for personality.
If they decide not to sign up, we don't charge them the $80. It's just they get a free consult. We make sure that they are a good fit as well. Like I said,
we do some meet and greets, but
most of the time they just always sign up. It's like, oh, this is too good to be true. And then we're like, yeah, it is basically. But
in the regular medical system, when I was doing a lot more clinical care in that system, a lot of the visits, I don't want to say a lot, that's probably strong, but at least once a week, there would be an interaction where the patient left unsatisfied or unhappy. So far, in a year and a half of being open, we have not had anybody leave unhappy. We don't have those types of interactions with our patients. If we are not able to provide the care that's going to be needed for somebody, we're pretty upfront about that. I don't have to, quote unquote, carry water for the insurance companies. And so I'm very upfront. We're very upfront about what it is we can do, how cheaply we can do it, how cost effectively, and how, medically effective we can be for that patient. Meet and greets, no problem. Come in. Some folks, if you're worried about you've got a problem that's maybe something we may not be able to handle, I'll be pretty upfront with you that say, hey, this model may not be in your best interest. The system, it's a system that's exists for a reason, and certain patients need to utilize the system more than others. But it's very rare that we have somebody come in who doesn't derive value from what we've got going. Like I say, the other thing is if if folks have questions, same thing, post them underneath those questions you've got about the model. In general, I'll be in the comments answering questions, or Matt will be in the comments, or more than likely Steph will be in the comments answering questions.